We've got a case study today, and this case is unfortunately a very common one. And so I want everyone to listen through what happened and then think about the emotions and why somebody would have made some decisions that they did and why necessarily those weren't the best way from a business perspective and from a team perspective and from a patient perspective. Bert, do you want to lead us through the situation that you are dealing with one of our clients?
Yes, I'd be happy to do that. Here's the scenario. And this happens a lot with clients with production-based incentive. This was the pre-visit numbers before I went in, 3 hygienists. We're doing about 54 a month. You can see fluoride production was not great. No sealants, no sealant protect, very few x-rays were happening. Perio was very slim. And then we trained. I did a hygiene explosion day with them, which is our initial preventive role. And then we did perio in May, post-COVID. And here's where they are now. So up about $10,000 for the month. And you can see the difference in fluoride, the number of sealants have gone up, and the x-rays have really gone up, probably 100-fold with PAs, and their perio's up about 3%. So doing really well.
Just to backtrack a little bit, one of the strategies that we use to improve the quality of patient care is to have incentives on certain things for providers and certain things for non-providers to make the office run more smoothly. So this particular incentive was a production-based incentive for the hygiene team. So we have a formula that we have to gather a bunch of data, do some analysis, but then we come up with a formula that works for everybody.
So the original goal was set at $14.40 a day, about $180 an hour for the hygienist, which is really great. When we go into practices, a lot of times they're at 120, 125, some under 100, right?
Oh yeah, for sure.
Patient. So 180 is a pretty steep goal, but we teach everything they need to be able to achieve this. So they knocked that out the park and got it. So they recalculated, right, the goal, because you never move the carrot unless, right, there's a fee increase or the hourly goes up. And they recalculated to 192 an hour, and they're still beating that. Okay, so they're beating that goal. One of them's doing 2,000 a day, the other one 1,586 on average. I'm sure there are higher days. So here are some of the concerns that the doctor has. So incentives are sometimes as much as $600 a month for a hygienist. Doctor doesn't feel hygienists are doing enough to warrant that with what he's seeing, feels it needs to be raised again, and looking at what's going on, going out instead of what's they're bringing in to generate that.
So what this doctor didn't understand was that he had $6,000 additional dollars coming in every month, and he was paying out $600 in added incentives. So the hygienists went up by $600 a month, but the practice went up by $5,400 a month. So the question that I always ask doctors is, would you like to lose, I should say, $5,400 in order to gain $600? When they look at it that way, their logic starts to shift. And so that's really what they're expecting. Now, I know there are some, they didn't just ask for a $600 a month raise, they're performing at a higher level. And the greatest beneficiary of them performing at a higher level is who?
The patient.
Exactly.
Yeah. And let me talk as a hygienist, right, at the moment, who was in a situation that was similar to this. And I always called it moving the carrot. So the carrot would be placed, right? The goal would be set. And then when I got the carrot, it would be, oh no, that's not where the carrot was. So in essence, if you change the goal, you're moving the carrot, which kills the morale. And we all want to go, what's the point, right? Because the carrot keeps moving. And that is so frustrating as a team member to not have clear expectations about where that carrot is and know now I've got it, but then it gets yanked out of your hand, right? Yeah. Because the doctor doesn't like where the carrot is.
And this one decision could be a $60,000 a year, 60 some thousand dollar a year loss. And of course, that loss continues forever. So if you have 10 years left in your career, you just lost 2/3 of $1 million.
Right. And that's just one hygienist, Dr. John, because together the hygienists have impacted 10,000 a month.
And this one decision could be a $60,000 a year, 60 some thousand dollar a year loss. And of course, that loss continues forever. So if you have 10 years left in your career, you just lost 2/3 of $1 million. $1.2 million of retirement funds or lifestyle funds gone because of a decision that was made based on how it feels. Let's look at the data. Let's make decisions based on data and not on feelings. And that'll help us become much better leaders, much better managers, and have, in this case, a higher level of quality of care for our patients.